Hi, my name is Patience, and I live in the state of Alabama. So, some of the key elements of informed consent in my state includes the purposes, goals, techniques, procedures, limitations, potential risk, and benefits of the services performed, and also the client's rights. So, when clients are given informed consent, it can be done verbally or it can be done in a written format. One thing that you have to be aware of when it comes to informed consent is the minor's inability to give consent. That is something that has to be done by an adult or a parent. Other things that you have to be worried about is dual relationships. So that could be families, social, financial, business, any personal relationships that may interfere with the person that you are doing counseling with. Also, your patients or clients should be notified about non-payment of fees and the use of collection agencies, retention and destruction of records, as well as any treatment plan that may take place. They need to be informed of all those things. All this information is found in the Alabama Board of Licensure, so they have it there. Also, within that, there is information about informed consent when it talks about research. So, when it comes to informed consent and counselors wanting to do research, they also have to make sure that the patient or the client knows about the topics, that their participation is completely voluntary, everything will be confidential. They should also be have a commitment to their participation and then give the explanation of what is going to be happening with the data that is collected. All right. So also, I found in the state of Alabama, there is this service called Thrive Alabama. And Thrive Alabama deals with mental health services. And so, in the mental health services informed consent, it talks about the goals of the counseling, and it includes in there that generally by the fifth session, the client and the mental health counselor will agree upon an individualized treatment goal in the treatment plan. It also discussed the risk and the benefits of counseling, any appointments, the confidentiality and the privacy, record keeping, telephone calls, texts, and social media. Also, what happens when you get ready to end therapy. So, the section that I will be reading specifically from this informed consent is going to be the goals of counseling. There can be many goals of mental health treatment. Some goals may be long term goals, such as improving your quality of life, learning to live with mindfulness, or self actualization. Others may be more immediate goals, such as decreasing anxiety and depression symptoms, developing healthy relationships, changing self defeating behavior, or decreasing or ending drug use. Whatever the goals, they will be set by clients in collaboration with mental health professionals. The mental health professionals may make suggestions on how to reach goals, but the client decides whether to act on any suggestions. Generally, by the fifth session, the client and mental health counselor will agree on individualized treatment goals and on a treatment plan. So that is from Thrive, Alabama, that we have here in our state. Also, in our discussion post, we are to compare and contrast ideas that are in connection with the ACA Code of Ethics as well as the Code of Ethics that is within our state. So I did a little compare and contrast chart. So things that are similar that we have is the freedom to choose. So when it comes down to the client wanting to choose, they can either choose to stay in therapy or they can choose to leave therapy. Whatever they do, again, their participation is completely voluntary. Again, the verbal or the written consent has to be given. They also compare with the purposes, the goals, techniques, procedures, risk, and services. Those who are unable to give consent is also a comparison that we have. And then it talks about a previous relationship, which I referred to earlier as a dual relationship. So having a family, social, financial, or personal relationship with somebody. Also, the payment of fees. Now, some contrast, things that I found listed in the ACA Code of Ethics that was not in the Alabama Code of Ethics includes the death of a counselor. So if a counselor passes away, they have things that are in place with ACA that are not necessarily a part of our state or my state. The role of technology, social media, is a big thing. When I was getting ready to do my Thrive Alabama, I noticed that they also had an informed consent about technology and being able to do telehealth visits and things of that nature. Also, with the code of ethics, they want you to have your credentials, and then they are also making sure that people are developmental and culturally sensitive. Mandated clients. That is another thing that is not in the state of Alabama's code of ethics, but I am aware just from my previous work at the courthouse, knowing that some clients are mandated to go to mental health counseling. We have a location here in Tuscaloosa called Indian Rivers that does substance abuse counseling, and those are court order or mandated clients that have to attend that. Other things that were in contrast includes extending your boundaries. That's not one thing that is in the Alabama Code of Ethics, but it is in the ACA Code of Ethics. So sometimes clients will ask their counselor to come to their wedding or to their graduation or even help them come to visit someone in the hospital who may be sick. So I found that very interesting. And also the role in changes that may happen. There are some instances where a client may start out as an individual client, then they want to transfer over or make it a family counseling, or vice versa. It may start out as a family counseling and then they want to go to an individual counseling. So those are some compare and contrast that I found within the 2014 ACA Code of Ethics as well as the 2016 Alabama Code of Ethics. And so that is the end of my discussion post. Thanks.